I learned that I was taught wrong in school, that there was so much more research available than we were taught in our nurse practitioner program, and that hormones were put in our bodies for a reason. They are absolutely the best way to decrease insulin resistance and help prevent chronic disease.
Welcome to the Get Your Marriage On podcast. I'm your host, Dan Purcell, a sex and intimacy coach for married couples. My mission is to help you build and maintain a sexually vibrant and emotionally intimate marriage. Join me each week as we explore principles and practical tools based on Christian values to create the passionate, joyful, and thriving marriage you're designed to have. Hi, friend. Welcome to the Get Your Marriage On podcast. So grateful to be able to talk to you today, and thank you for listening. Last week, we talked about sexual health. We talked about testosterone. We talked about natural ways to boost that with Dr. Jerry Duggar. Today is a different perspective on a very similar theme. We're talking about hormones and libido from a woman's perspective, but also men too, with Shelly Wilkinson. I'll introduce her later in this episode. You'll get to hear her credentials and where she comes from. But one thing that I've really appreciated about Shelly is her absolute passion for helping women and men just to be at better health, better, stronger health. She looks at hormones like they're vitamins. She gets really personal. She talks about her own sex life. Nothing inappropriate, of course, but it just shows that she is a walking testament of how these medical interventions have really helped her and in her relationship. So I hope this information is helpful for you. If you're in midlife and feeling the differences in sex drive as your body changes, I hope this is a helpful resource for you to guide you in the right direction, to help you on your journey so that you can have a fantastic and joyful and intimate sexual relationship far into your second half of your life. A few quick announcements. One is we have our men's and women's small group coaching cohorts. They're starting in May, and the information is on our website. You go to getyourmarriageon.com, click on events, and you'll see them there. This is ideal if you're in a marriage where you get along really well, you're good friends, you're quote unquote good business partners, but you wish things were better when it came to sex and intimacy and emotional intimacy. If you find yourself in a situation where you just can't really talk about deep things very easily or well, or the frequency of sex isn't quite what you want it to be, or the variety of sexual experiences that you're having, you're ready for something more, then this is a great opportunity for you. It's 14 weeks long. You meet in a very small group, which is 6 to 10 men or women, and we go through the Get Your Marriage On course as part of our next level program together. And you get a few opportunities for private coaching within that also. It's affordable and fantastic for those that want that. Secondly, we have our Get Your Marriage On cruise coming up. We just have a few spots left, and I highly encourage you to come because this is going to be a week-long fantastic vacation, super romantic. We're in the Caribbean, and you get a vacation with me and my team, and we, on the sea days, so the days we're like at sea, we spend a few hours talking about going deeper in our sexual intimacy and what that really looks like. I'm also bringing on a boudoir photographer. It's optional, of course, to make this something a little memorable, something you probably normally don't do, that just is a way to celebrate you two as a couple and the beautiful, intimate, and joyful aspect of marriage that you get to enjoy. So we're doing a deep dive on that. It's going to be a very fun and exciting vacation. You'll find those details also at getyourmarriageon.com. All right, now let's get started and talk more about hormones. Shelly, welcome to the Get Your Marriage On podcast. I'm really looking forward to the conversation we're going to have today all about hormones and functioning sexual health. But I'm just really curious about you. How did this all start for you?
Well, thank you for inviting me, Dan. I appreciate the opportunity to share. My favorite thing is to share solutions I've found to common health problems. So I'm a family nurse practitioner, board certified for the last 23 years. My experience in nursing has been emergency room, internal medicine, and urgent care. And then back in 2014, I started my own business. It's now an integrative medicine practice, but I started it out as a med spa, just doing cosmetic injections. Within 2 months after that, my son was 5 years old and he had severe food allergies. and he had eczema
Mm.
all over his whole body. He had anxiety and his stomach hurt all the time. He didn't sleep through the night till he was about 18 months
Mm.
old. I had to sleep in the lazy boy with him. I wondered how anyone could ever have more than 2 children because I was
Right.
exhausted. And finally, when he was about
Uh-huh.
5 years old, we we were teaching CPR with a nurse friend of mine, and she gave my son a
Mhm.
granola bar, and I'm looking at the ingredient list to see if if he could eat it because he was allergic to everything.
Uh-huh.
And she suggested that I send him to a nurse down in Utah County who did a Chinese medicine allergy elimination technique called NAET.
Uh-huh.
So we went to this, and I was open enough to try it, but I wasn't sure whether it would help or not, but I was open enough to give it a try because we had done a peanut challenge that my son passed before that, but he still felt like his throat was closing every day, and they'd have me give him peanuts, and I had to give him every so often, but he still felt symptoms, and I'd have to give him Benadryl every
Mm.
day for this throat closing feeling. So I took him to this woman down
Uh-huh.
in Utah County for this treatment, and within 2.5 months, he was eating everything, his eczema was gone, and his anxiety was so much better, and I was shocked.
Oh,
I
wow.
was just in
Uh-huh.
shock because that's impossible in Western medicine. We saw his blood levels drop from like a level 5 allergy to a level 2 allergy, and it was crazy. He was drinking milk, which would have caused anaphylaxis before for him. And so that was
Uh-huh.
fascinating to me. So within that next year, I started learning that NAET, it stands for Nambudrapad's allergy elimination technique. So I kind of pulled this Eastern medicine technique into my practice because I could not believe how much it helped. So through that, I learned acupuncture and started practicing acupuncture as well. And then in 2023, in the middle of the night, I had an inspiration where I felt God just say, "You need to learn hormones." And I had had women begging me for years to learn bioidentical hormones. I told them, "I think it's good. You go learn it. I have way too much on my plate. I can't learn that. It feels too big, but go do it with someone else." So that night,
Uh-huh.
when I got that inspiration, like, "You need to learn this," I'm like, "Okay." So I
Uh-huh.
made a deal with God. I said, "Okay, this is what I
Uh-huh.
need from you. If I'm going to do this, I need a research-based course, like intensive. I want to learn this forward and backward and upside down, and I need it to be in person because I learn better that way than online. And so I'm going to get on Google right now. Tell me what to type into Google." And I had actually been searching for something the day before because I wanted
Uh-huh.
one of my other nurse practitioners to learn hormones, and nothing popped up. But this night, in the middle of the night, this class pops up, and I'm reading all the reviews. They're all 5-star reviews, and they're from
Uh-huh.
pharmacists and doctors from all different specialties, nurses, nutritionists. They were all 5-star reviews. So I'm like, okay, this is the class I need to take. And I look up where it is. It's in Canada. And there's 4 modules
Uh-huh.
that you have to take in order. So I'm thinking, how much is this going to cost me? I've got to fly to Canada 4 times. And then at the very bottom of the page, I saw in little red letters, US course also
Uh-huh.
available. So I emailed them and I said, "Is there
Uh-huh.
actually a course in the US?" And they said, "Yes, you're looking on the wrong website. Same teacher, but it's in the US." And so I look at it, and of all places, it's taught in Salt Lake City.
Which is your
This
near your
is right
hometown.
where I
Uh-huh.
live, and it started that Friday. This was a Monday. So part 1
Oh,
started
interesting.
that Friday. So I
Uh-huh.
knew it was a sign. I just told my husband, "Okay, can you take care of all the kids' stuff this weekend? I have to go to this training, and there's 4 modules that you take." My staff has taken the modules several times over. We're really focused on
Mhm.
research-based education and finding natural solutions for our patients.
So you started it as a strictly Western medicine
Mhm.
practitioner, right? Nurse practitioner. And then you have this challenge with your son. An Eastern approach helps that. And that opens your mind to wait. Maybe a combination of both can really help
For
here.
sure.
Then you built this business off of like integrating like acupuncture and health and wellness in general. And then in 2023, you had this strong impression, felt like inspiration from God. we got to study hormones now, which was very different from what you've been doing to
I
that
didn't
point,
want to do it.
right?
I didn't even want to learn it. It felt
Right.
so big, and now I'm so passionate about it because there's so much research.
That's so cool. All right. So then you take this course, and what were some of the big ahas that you learned by starting to study hormones?
I learned that I was taught wrong in school, that there was so much more research available than we were taught in our nurse practitioner program, and that hormones were put in our bodies for a reason. They are absolutely the best way to decrease insulin resistance and help prevent chronic disease. And so after that first class, I put myself and my husband on hormones. And then within a few months, I started accepting patients, even before I'd finished all the trainings, because I was just talking about it and sharing what I had noticed. And so many people wanted to join. Within the first probably 9 months, no, less than 9 months, probably the first 7 months, we had 200 patients
Wow, that exploded pretty
really
quick.
quick.
Gotcha.
Yeah.
But you're like, I'm going to be my own guinea pig here. Let's try this on
Yes.
me and see what that's like.
Yes.
Great.
Yep.
Great. So tell me about what were some of the things you're hoping to experience when you started, trying the hormones for yourself? Like what problems were you looking to solve or what did it do for you? What did you notice?
I noticed increased energy. I noticed increased
Uh-huh.
stamina, endurance, decreased brain fog. Like my brain just was
Uh-huh.
so much more clear. For sure,
Uh-huh.
increased libido, which is always nice when you struggle with those
Right.
things. And energy was my biggest one. I was low
Uh-huh.
energy. I have PCOS, and one of
Mhm.
the side effects that you can get with that is extreme afternoon drag. I didn't know I had
Yeah.
PCOS till I did this training and learned how to actually diagnose it, but getting my energy up was huge for me.
That is so cool. Let's do a little sidebar on
Okay.
PCOS. Polycystic ovarian syndrome, I think is what it stands for.
Yes.
And I've had friends and extended family members with
Mhm.
it, but you have a different take on it than what most people think, I think. Tell me what you think
I
about it.
learned so much through this training. There's so much research on it. So PCOS stands for polycystic ovarian syndrome, like you said, but it's a misnomer. It is not an ovarian problem. It's a metabolic problem, and it should be called genetic insulin resistance. It's a luteal phase
Okay.
defect where your FSH and LH are flipped. The ratio is flipped, and it's genetic. At least half of the women don't have cysts in their ovaries. They don't have the classic symptoms of acne, facial hair, infertility, cysts on their ovaries.
Mhm.
At least half of the women who have this are thin, they're fertile, they have no acne, they have no facial hair. So it's like a spectrum where you have
Okay.
extreme on one side and then someone you might not even know who has it, but you can tell from the labs if they have it or not, if they're premenopause in that FSLH ratio and where those
Mhm.
are sitting. Problem with PCOS is many women who have PCOS have low progesterone levels, and progesterone is extremely protective against breast cancer, uterine cancer, and ovarian cancer, contrary to what we are sometimes taught in traditional medicine. It kills cancer cells in the breast, the ovaries, and the uterus. And it's very
Mhm.
different from the fake progesterone that's in birth control pills, which also shrinks the uterine lining but can increase your risk of breast cancer and blood clots. So many women have this low progesterone level, and in the first trimester of pregnancy, the progesterone that the mother makes genetically is what keeps that
Uh-huh.
pregnancy alive. It what keeps the
Uh-huh.
pregnancy. And so if genetically you don't make enough progesterone, some of these women just lose baby after baby after baby after baby. And so giving that progesterone back to them can be extremely helpful. Also, hormones are very helpful at shrinking plaque in the brain and in the blood vessels. So, if you don't have enough of certain hormones, then the plaque can grow in the brain and the
Mhm.
blood vessels, contributing to dementia, Alzheimer's, heart disease. Also, for your bones, hormones are so important. So, when you have PCOS, your hormone levels are altered. Typically, your thyroid hormone levels aren't high enough, even though they might read in the normal range. But with someone with that genetic predisposition, normal's not good enough. You'll be exhausted. And
Right.
the progesterone is also an issue with that. So I had this extreme fatigue all through college, through graduate school. I was so tired every afternoon in class. I'd have to get up and take my notes in the back of the room, pacing across the back of the room because I would fall asleep. I was
Just to
so
stay
tired.
awake.
I'd have
Uh-huh.
to go to the gym and put my textbooks up on the treadmill and walk fast enough that I wouldn't fall asleep and slow enough that I could read my textbooks that way because I was so tired. So it was revolutionary for me to just get my thyroid
Mhm.
working, to get my progesterone levels working. It helped with my sleep, it helped with my mood, no PMS. Periods are no big deal now. So it's been amazing.
That's cool. So I run a private Facebook group. It's very active, and oftentimes one person complains about their spouse's low interest in sex. Comments start to fly, and invariably, many people,
Mhm,
not just some, but lots of people say, "Oh, go get your hormones checked."
mhm,
And my practice and my experience with marriage coaching and helping couples with their sex lives really is more on the psychological and the relational
mhm,
level. So I'm not really qualified on the health level. And it's easy for me to dismiss, "Oh, no, it's not a hormone issue, it's a relationship issue," or whatever, because that's all I know.
mhm.
But I'm starting to open up more and understand there's a lot more to this. So this is your world. So let's say someone's like, "Okay, maybe I do need to get my hormones checked." And they sit down with you. What's the very first thing that you work with them? What do you look for? You've ordered the blood test. What are you looking for specifically that others might miss?
Okay, so first of all, it's important for both spouses to get their hormones checked because it might not be just one or the other. It might be a combination of the two where they both need something tweaked.
Oh,
And so typically I will
tell me more about that.
um
Yeah.
so with men, andropause is a real thing. It's like menopause for men where their androgen levels will
Mhm.
drop. And just because of all of the endocrine disruptors in our world today, testosterone levels are lower in a lot of men than they used to be. And so that
Mhm.
can really affect libido, it can affect weight gain, energy, and so many things. And so we need to
Mhm.
check men and women. So we're checking cholesterol, we're checking glucose. These are measures that kind of indicate how much insulin resistance do you have. We're looking at
Mhm.
fasting insulin levels. We're looking at waist circumference and all the hormone levels. And I typically will ask the patient first, what's your goal? Like, what's bothering you the most and what do you want to work on? And if it's
Mhm.
libido, we kind of start there. If it's, you know, I just am exhausted, then we start there. If they're having hot flashes or bloating or other symptoms, hair loss, then we kind of start with whatever they are interested in and whatever's most important to them. But we do order the same lab panel for everyone. It's pretty comprehensive. So we're looking at hormones, we're looking at glucose, insulin, we're looking at thyroid function, we're looking at vitamin and mineral levels. So there are lots of things that kind of create this big picture of how do I help you?
Yeah. Okay, great. That's good that you take a more, systemic approach, like, let's look at them both together and see how there might be an interplay of the 2. Okay, maybe it's the wife and she wants to have higher libido. What do you do next?
So I'll definitely look at their testosterone levels. And if they're
Mhm.
low, then depending on their situation, sometimes they have PCOS, they're going to be super sensitive to testosterone. And so we have
Mhm.
to make sure they're ready for testosterone. Sometimes there's another medication that we give to decrease the sensitivity, but we go very low, very slowly with increasing that testosterone. That can help. Other things that can help are just normal supplements, vitamin D and DHEA can be extremely helpful. And so we'll kind of look at those levels as well and see where they're at and start there. We also have some procedures that we do in our office. We're up on like cutting edge technology here. We're all about education
Uh-huh.
and what works and what is least invasive. So we have some women's health treatments that are extremely helpful for libido and just, improving satisfaction, helping with stress incontinence. I mean, that is extremely common and women don't like to talk about it, just like men don't like to talk about ED. Women do not like to talk
Uh-huh.
about the fact that, they sneeze and they pee their pants. But if you've
Right.
had
But it can't jump on the trampoline or
Yes, if
whatever.
you've had babies, it's very common. You're in the norm if you do struggle with that. So we have some technologies that help with that. We have a machine called Formavi, and it's a
Uh-huh.
wand. It's in this little package here. So
Okay.
this is radio frequency heat. And so there's this little
Okay.
wand that we use, and there's these three little metal plates. On the end of it, we put
All right.
some gel on there. And
Uh-huh.
this helps strengthen the tissue inside the vagina and outside of the vagina. As we age, the collagen kind of goes away. Everything gets kind of saggy and wrinkly. And so this just is for tightening and rejuvenating the tissue, bringing more collagen in there. And it's all just heat. It's very comfortable. And so
Uh-huh.
this helps a lot with just tightening things up, which makes things so much easier with intercourse.
Uh-huh.
The other one that we have is for strengthening pelvic floor, and that one looks like
Okay.
this. It's like a big tampon with like two little
All right.
electrodes, and this
Uh-huh.
goes in the vagina, and you put it in there, and it's EMS frequency that comes out, and so it causes those pelvic floor muscles to contract. So it's like doing
Okay.
Kegels on steroids. It's the only FDA cleared device for strengthening pelvic floor in addition to Kegel exercises, and it works so well. So doing those treatments is also really helpful for improving that
Mhm.
experience for both the husband and the wife.
And you have a personal story about this too. Would you be willing to share that?
Sure, it's pretty personal, but I think women and men probably need to hear it because if I had
People
struggles,
benefit.
then
Yeah.
probably other people
Yeah.
have struggles too. So I'll share my story.
Should we back up to your honeymoon?
Sure. So
All right.
on my honeymoon, I mean, I was a virgin before I got married, so I just didn't know stuff, I didn't know what was normal, what was not normal, and when we were on our honeymoon, I found it interesting that my husband didn't wanna have sex every single day, and so I thought,
Oh,
"Oh gosh, is there something wrong with me? Like, are you not attracted to me?" And so that kinda started me feeling super insecure
okay.
from the
Uh-huh.
get-go, and for him, he's just like, "You know what? There are more important things. Like, yes, the sex is great, but, like, sleep is also really great too." And so and
Uh-huh.
so,
You were college students at the time, I assume.
we were I was graduated, he was just finishing up. But anyway, so I didn't climax ever on my honeymoon. And I got
Mm.
home and I'm like, what is wrong with me? Something's wrong with me. I I don't know what to do. Anyway, I was talking to one of my best friends and she's like, Shelly, you got to figure this out. You have to figure this out or you're
Uh-huh.
going to get really resentful if things are good for him and they're not good for you. And so we
Okay.
figured some things out, but it would still take me like an hour and it's a really
Uh-huh.
long time. I felt really insecure. I felt really selfish, kind of making my husband continue to help me. And then sometimes he'd fall asleep. And then it was all over. Like then there's no
Yeah.
emotional
Uh-huh.
connection. And so that it just was really difficult. And so when
Yeah.
we started hormone therapy, we both started testosterone after I took this first training. And
So this is within the last few years we're talking about
yes.
now. This is a recent
Yes, and we
uh-huh.
got married a little older, we were almost 31, we got married, so probably for 17 years, it just took a long time, like an hour, and it was
Yeah.
hard,
Uh-huh.
and we wouldn't talk about it because I didn't have any solutions, and so I didn't have any suggestions or I didn't know what to say or how to help, and
Mhm.
so we just didn't talk about it, and then when we started
Yeah.
hormones, my time cut in half to 30 minutes, and I was like, "Whoa,
Uh-huh.
this is the best." Like, we've never had a better
Uh-huh.
intimate relationship. Like, it would just we could start talking
Right.
about it. It opened up the conversation. He was more interested more frequently, and it was easier for me, and
Mhm.
so that was awesome. And so then
Mhm.
but I still thought a half hour is kind of a long time. That's still kind of a long time.
Uh-huh.
And so I was seriously considering, I'm like, maybe there's something with my anatomy that is off.
Uh-huh.
And maybe it's just making things more difficult. And so I was seriously
Mhm.
considering getting a labiaplasty because I thought
Uh-huh.
maybe
Which is a
the
surgery to
surgery that
remove
removes
extra
extra
skin.
tissue,
Uh-huh.
just exposing things a little bit more. So I was seriously
Uh-huh.
considering that last spring, and I told my husband, "I think I'm gonna do this. I think I'll just do this. Our insurance will pay for it, and I think I'm just gonna do this." And he's like, "Whatever you wanna do, that's
Mhm.
great." And then I bought this machine. I was the first in
Mhm.
Utah to purchase this machine. I learned about it at a training, and it's called Apex RF, and it's the same treatment as this for women, the Form of E.
Now you're holding it up. So those for listening, what are you
So
holding
this
up?
is this is the women's one, but the men's one looks like this. It's like a little wand with some 3 little metal plates on the end of it that radio frequency heat comes out of. So I learned about this machine at a training, and it helps improve collagen and blood flow for men.
Uh-huh.
And so, in about 70% of cases of a man who's struggling with erectile dysfunction, it has to do with blood
Mhm.
flow or diabetes. And this treatment
Mhm.
helps with that. And so it's like a brand new solution that's been available for women for a long time, but it just barely came out with the technology to do it for men. And so I was sitting
Okay.
there watching this conference and seeing the research on it. And I thought, I have to have that
Uh-huh.
because I treat a lot of men. We have a ton of men. And I would say at least 50% struggle in one aspect or
Uh-huh.
another with sexual dysfunction. And so I thought this is a great solution. So I bought the machine, and my husband had to be the guinea pigs for me to learn how to use it.
Of course.
Neither of us
Uh-huh.
thought he needed it, but I'm like, "You have to come in. I have to learn how to use this." And so we did his treatments. Typically, it's 1 treatment a week apart for 5 or 6 treatments, and it improves the blood flow. And what I was surprised about is that it actually helped me. And so
Oh.
after about 4 treatments or so, I told my husband, "I don't need a labiaplasty. If you do this treatment, I don't need a labiaplasty because it just helped so much." And so the treatment improves size, girth, sensation, and duration. And so, but it
Mhm.
really helps for the women as well. So my time went down to like 10 minutes. And I'm like, this is amazing. I'm so glad I bought this machine. I need to tell everyone about this machine because it will help.
Uh-huh.
It's kind of a combination of everything. Like once you can open up and talk about things, once you found at least one solution, it opens up that conversation, and then the emotional piece is there, and then you find out, the physical solutions, and that can be just life-changing. Like, we're happier than we've
Mhm.
ever been in every aspect. So,
Yeah. And Shelly, do you find that too with those that you work with? As you help them improve their sexual functioning, other parts of their life and their relationships tend to get a little richer, more
absolutely,
fulfilling.
absolutely. In fact, I have people tell me all the time, "Shelly, I don't think you have any idea how many marriages you're saving just with hormone therapy." And I'm
Uh-huh.
like, well, it helped me, so I'm sure there are several people that it's helping.
That is so inspiring.
Mhm.
That's great. I have a friend who she tells me she feels awful often. Hormones are way off. And that part of her menstrual cycle where she's bleeding, it's like going on for 3 weeks of
Mhm,
bleeding instead of just, 5 days that her old typical self was, and no libido, no
mhm.
interest. So someone like that. So they reach out to you. Is it a blood panel or a test? What other things besides just looking at as a holistic practitioner do you look at besides just what's going on in with levels of the hormones, so to
So
speak?
levels are really helpful, and so that is
Mhm.
the primary thing we look at, but we also look at family history. That's a big deal. There are so
Yeah.
many things that pass down, and we can kind of tell how much insulin resistance there is based on family history or what's coming for them based on their family history, their personal history. We really like to hear, okay, tell me what happened when you first started having periods. Do you have PMS? How long are your cycles? Do you have a lot of bleeding? Do you feel pain when you ovulate? So we're asking all of these questions to kind of paint a bigger picture to personalize it for them and figure out what solution for them is going to be the best.
You've said several times in this conversation, I'm just picking up on this, about insulin resistance and diabetes. This somehow has a link with hormones. Can we do a little deeper dive on what you mean by that, and what can people learn from that? What can they do at home to improve their functioning in that area?
So, as hormone levels start to drop off, insulin resistance goes up. So, because
Oh,
hormones are the easiest way to get insulin resistance down, in addition to lifestyle changes, exercise, and eating right. And so, when we are doing things or when we have a genetic predisposition to have higher glucose or spiking glucose that continues to go up and down, then we're at higher risk for chronic disease. So, when you have high glucose or spiking glucose throughout the day,
uh-huh.
then your insulin levels are going to go up. And insulin is what pushes glucose into the cell and out of the bloodstream,
Yes.
but the cells can become resistant to insulin. Insulin's a hormone. Cells
Mhm.
can become resistant to all hormones. And so in a diabetic, type 1 diabetic, we're going to give insulin to drive that glucose into the cell to decrease the circulating glucose levels. When you have high circulating glucose and high circulating insulin, because there's insulin resistance and it can't push it into the cell, then you're going to have higher plaque levels. You're going to have higher belly fat. You're going to have fatigue. And so it's going to
Mhm.
increase your risk for diabetes. It's going to increase your risk for heart disease. It's going to increase your risk for brain disease. It's going to increase your risk for cancer. It's going to increase your risk for osteoporosis. And when we give the body the level of hormones that it needs, it will decrease that insulin resistance and it helps decrease your risk for all of those chronic diseases. That makes sense?
Gotcha. Yeah. And so does the reverse also helpful if you work on lifestyle changes to improve my health, diet, more exercise, so I would decrease my insulin resistance? Do hormones that are already my body's creating are more effective in that
Exactly.
case?
Exactly. So, and
Gotcha. So they kind of serve each other
for
too.
sure. So diet, you're going to want to make sure that you're trying to keep your glucose as stable as possible, and that will keep your insulin stable. And so like wearing a glucose monitor would be a really good idea to see like which foods tend to spike me, what activities tend to spike me, what does stress do to my glucose level. And so that's another lifestyle thing that can be extremely helpful for stabilizing glucose. When insulin resistance is down, your libido is going to go up.
I wore a monitor on my
Mhm.
arm for a month to learn about my diet and what it did to my body. It was fascinating. It was great. Now, you talk about it's more than just, injections, and people start feeling better quickly with that. But don't you also help with mindfulness and meditation also? Can you talk on that
Yes,
component?
for sure. So it's a whole big picture. So when we have a hormone patient come in, they'll meet with one of our nurse practitioners and then to go over all their labs and make a plan. Then they meet with our holistic health nurse who does the NAET allergy elimination and making sure that they're not reacting or sensitive to anything we've given them. And in there we talk about mindfulness and just kind of like the whole picture of health in every aspect of health. And she'll have you fill out a survey and answer a bunch of questions about sleep and about spirituality and about your mental health and all of these things because it's all part of the picture of health and everything plays a part
Mhm.
together to make you feel well.
Uh-huh.
Then we have
That's so good.
a strength and stability assessment with one of our fitness instructors. And so they'll meet with
Uh-huh.
her a couple of times just to kind of see, okay, where are you at strength wise? And do you have the functional strength you need as you age to push yourself up off the ground or to pull yourself up out of a chair? And so she'll kind of assess where you're at with that strength because we want you to have a lot of lean muscle mass. Not only will that bring your glucose down, but it will help you live healthy longer. So we talk about that and kind of set up a plan of okay, these are the exercises you need because this is where I can see that you're lacking as far as muscle mass. So we put that piece
Mm.
into it as well. But we need someone like you. We don't
That's
have a sex therapist. We don't have somebody
yeah.
working on that emotional piece with the couple, which is really
Mhm.
important.
We're all part of, like, a bigger
Mhm.
system. I like that approach. So if they don't live anywhere near where your clinic is, what are some specific questions that a person should ask their doctor if they want help with their hormone treatment? Like, what things do other people miss? So you got to make sure you're asking these questions.
So I think it's really important to know what training they have, where they were trained,
Hmm.
and where they got their hormone information. If it's just traditional medical school, it's not going to be enough. It's just not. Like if they
Okay.
haven't done outside training on bioidentical hormones and how they help with insulin resistance and preventing cancer and such, then they're not going to know enough to help decrease your insulin resistance. So there are a lot of people who call themselves hormone specialists, but some of them are just trying to make you feel good through menopause and andropause. They're not really looking to decrease your insulin resistance. And so they won't get you to the levels you need to be in order to do that, according to the studies. So knowing where their training is really important. Or we do the World Link medical training, and it's intensive research based 80 hours of going over study after study after study to learn all of the things about the synthetic drug company hormones as well as the bioidentical hormones and what actions those have. So training for sure is going to be very important. And what kind of hormones do they use?
What is bioidentical? What is meant by that?
Bioidentical means that they're hormones that match, that they're the exact same chemistry as the hormones that your body makes. They are made in a lab,
Mhm.
usually from a sweet potato, like the cholesterol ring of a sweet potato or something like that. But they all come from cholesterol, and they
Uh-huh.
are chemically identical to what your body makes. So your body knows what to do with those. If it's a synthetic drug company hormone that doesn't match our chemistry, like fake progesterone, like in birth control pills, our body does not know what to do with that. And that's why some women
Gotcha.
feel terrible on those things, because it will knock out all of your natural progesterone because it binds more strongly to those progesterone receptors than real progesterone does, kicking out your natural protective progesterone. And it can increase your risk for breast cancer.
Gotcha. So it's really about a quality of the
Yeah.
product
And
that
does your
you
body know
right.
what to do with it or not? Does it match what your body makes?
Oh, got it. Great. Okay. Anything else you'd like to share with us about hormones and what to consider if you think this might be something you need to help you with your sex life?
I just love when I can give patients a solution, even if it's just testosterone or even if it's just
Mhm.
progesterone for the wife to help stabilize the mood. I mean, sometimes, especially in perimenopause, the ovaries are just erratically spurting out estrogen, and it can make you feel so cranky and angry and tearful, and then it can cause breast tenderness and bloating and acne, and here you are like in your 50s and you're getting acne when you shouldn't have acne anymore. So it's just really nice helping couples with this, whether it's libido, whether it's just feeling good or their brain state. So hormones for sure are where I would start. And then
That's great.
these other solutions, it's very individual based on what your needs are.
That's good. So, Shelly, tell me more about men on testosterone long term.
So when we start testosterone therapy for men, we have to be sure that they are done having children, because there is a small
Okay.
chance that it will make them infertile. And typically, while you're taking testosterone, you're typically infertile because there's a feedback mechanism. If you're giving testosterone, the testicles aren't going to be making testosterone because it doesn't want to make too much. And so it kind of shuts down the testosterone production from the testicles themselves. But if they're not making enough, we don't care if we shut it down because we're just giving the body what it needs to have protectant levels. So for sure, we don't give testosterone to men if they're still interested in childbearing. But beyond
Mm.
that, if they're done, then they don't care if they're in that small percentage who becomes sterile from it. But just make sure
Mm.
you're done childbearing before you start.
And once you take it, you're kind of on it for life. That's my understanding.
So you can stop it, and the testicles typically will start producing it again. But if your natural production isn't high enough, then I don't know why you would want to stop it, because we want it to be high enough that it becomes protective. You can stop it and your body goes back to doing what it was doing before for the most part. There's a very small percentage that it shuts it down permanently, but for the majority of men, they'll continue to produce testosterone if they stop it. But then they also lose the benefit of taking it.
Yeah. I had a friend at lunch a little while ago. I know he's on testosterone replacement therapy, and I asked him what his experience is like. It's like, well, I give myself a shot once a week or every other week or whatever, and my shoulders are bigger. I can lift more weight. I growing hair on my back. I never used to have back hair, but now I do. My sex drive is back. I feel better about myself. He's like, oh, and my nuts are smaller. That says testicles. Right.
They do shrink.
But it's like, I don't think my wife would have ever noticed, but I know my body. So that
Women don't
was,
care about that, but that does happen
yeah.
because they're not, the testicles aren't active making testosterone.
Mhm.
Testosterone has more benefits than any other hormone. It's like if you
Oh,
could pick one drug to take to help with everything, it would be testosterone. Testosterone shrinks plaque in the brain and in the blood vessels, so it helps prevent dementia, Alzheimer's, heart disease. It also kills breast cancer cells. It kills colon cancer cells. And when testosterone
hmm.
breaks down, it breaks down 50 to 50% DHT, 50% estradiol. That estradiol component also kills prostate cancer cells. So the
Wow.
higher the level, the higher the benefit with testosterone, as long as you're not having side effects of too much. So side effects would be for men, irritability, acne, too much hair growth. We do laser hair removal here, so that kind of helps if men are having a lot of hair growth. But those would be the main side effects of going too high too quickly on testosterone. But the higher the level, the higher the benefit for the most part.
And isn't being overweight, we're talking obesity, actually is also an issue because don't we have enzymes in those types of fat cells that convert testosterone into estrogen?
So fat cells are going to produce estrone, which will convert upstream into estradiol. And so estradiol gets
Uh-huh.
blamed for causing breast cancer and things like that when it's really an innocent bystander. The visceral fat is actually the problem. And the higher the visceral fat, that's an indication of insulin resistance, the higher your risk for chronic disease. So you're going to be at higher risk for cancers and such from the visceral fat. If you actually gave estradiol to men or women in
Mhm.
menopause, it actually shrinks visceral fat and decreases the insulin
Hmm.
resistance. Testosterone also shrinks visceral fat.
Gotcha. Well, good. Good to know.
I think every man should use Apex. It even if you don't feel like
Uh-huh.
you have an issue, it can help you
Uh-huh.
and it can help your spouse for sure. And so when I first bought this machine, the husbands of the women that work at my office were our guinea pigs. I told them, "You all have to do this because
Uh-huh.
I need the feedback of what you notice and how well this works." And so all of the husbands came in, their
Uh-huh.
wives treated them. And I mean,
Uh-huh.
one of them's only in his 30s, and every
Uh-huh.
single person noticed improvement, and none of them thought they needed it. So I feel like it's
Uh-huh.
something that every man needs and every man should try, not just for himself, but for his wife.
So, do you put the wand behind the testicles on the perineum? Or does the device surround the entire penis? How does that
So
function?
it
How does
just
that work?
like it's just heat, and if this is the wand, it's just going
Uh-huh.
up and down. It's just
Uh-huh.
heating up, it's bulk heating of the penile tissue all the way down to the base.
Gotcha.
And so
Gotcha. So you run it up and down the length of
mhm.
the penis to just full
Yep, and we
coverage.
have very
Gotcha.
professional nurses. Some men are a little embarrassed
Uh-huh.
to talk about this, but once they
Right.
come in here, I mean, they keep conversation going, so they're not even thinking about it.
Uh-huh. This is
It's very
clinical, right?
clinical, very
Uh-huh.
professional. So it's just heat, and that improves the blood flow. So I don't know if you know this, but 40% of the penis lives inside the pelvis. And
Yes.
so when
Yeah,
you
it
do
does.
this treatment, it creates new blood capillaries. And so there's new blood flow going on, and that actually pulls things out. And so that's how it improves size, is it's just kind of pulling it out of the pelvis.
Gotcha. Cool. How is this different than, I don't know, just a heating pad or just heat
So
in
the
general?
type of heat is important. So the radio frequency
Okay.
heat is important because it's that type of heat that's going to improve collagen growth and improve the blood flow. And so it's the type of heat, it's very controlled in this machine. So it's not too hot, it's very regulated, but it's hot enough to be effective. So the machine will let us know, like, when it's at the effective heat, then it just lets
Mhm.
us know that we're there. And then if we're not at the effective heat, it makes a weird noise so that we get to the effective heat. So it's very controlled heating,
Got-
and the depth of the heat, the temperature of the heat makes a difference.
So the concept is collagen growth is important, and you can stimulate that growth with a very specific heat type application that you deliver through
Yes,
arcs.
and blood flow. Blood flow is the biggest part of it, but collagen is nice too.
Got it. Oh, blood flow is important too. Absolutely important. Yes. Great. Let's say someone works with you, they start feeling a whole lot better, their libido increases, they're feeling energetic again. Now they're ready to take their sex life to the next level. What would you say is a black belt sex tip for couples that want to have, now they're at baseline, right? They're healthy. Now they want to go to their next level sexually. What advice do you give
That's
them?
kind of a loaded question. It depends on what their goal is with their sex life. Are they looking for, like, speeding things up? Are they looking for greater sensation? Uh,
Uh-huh.
those types of things. For sure, some of these devices, the heat therapy devices, really make a
Mhm.
huge difference in that. I would say, for sure, start with hormones, because that
Uh-huh.
that's kinda like the basis to get you to a good baseline. And then, yeah, for us, for sure, the devices have been very helpful, like, just the tissue changes and things like that.
That is so good. Great. Where can people go to find you and your work and learn about what you do?
So they can go to our website at wasatchmedicalspa.com. They can call us on our phone number, 385-333-6000. Easiest is through the website, wasatchmedicalspa.com. And scheduling a free hormone education phone call is the best. We're licensed in several states, so we can practice in any state that we're licensed in. If we're not licensed in a certain state, then you would travel to come and see us a couple times a year. Typically, we do visits 4 times a year until you're optimized and at protective levels of hormones, and then we take it down to twice a year once you're pretty stable and steady. So yes, wasatchmedicalspa.com, schedule a free hormone education call where you'll learn about our process. And then if you want to continue and move forward with us, then we'll go ahead and get your labs ordered during that phone call and get you scheduled with one of our amazing nurse practitioners.
That's great. Awesome. Thank you.
I hope that was helpful and gave you a little bit of information.
Thank you for listening. Please share this podcast with all your friends, your married friends, that is. They'll thank you, I promise. And if you would like a little extra help in your own relationship to go a little bit deeper, to have more joy, a little more freedom, a little more happiness in your intimate and sexual relationship with your spouse, please reach out to us, check out our program. You can work with me and my team and take things to the next level. You'll find all those details on our website at getyourmarriageon.com. Meanwhile, it's your turn. Go get your marriage on.